Hello everyone, this is Paul from Ortho Eval Pal, and what I want to show you today is a young lady with a very interesting foot, and talk about how we can kind of manage this conservatively without necessarily having to go to surgery. And so Sue here has been having problems for a long time with not only a hallux valgus, an obvious bunion. She has a bunionette on the other side, but her chief complaint is pain at this spur, and we see this very often with people, especially when they start to develop arthritis. And what's happening basically is she's developing a large spur between the metatarsal cuneiform joint, and when I palpate it, it's not soft tissue swelling. There's a very, very sharp spur there. And so wearing a shoe is very uncomfortable. And the other thing that I want you to notice is look at the callus pattern that she has here. All right, so as she walks, her foot goes into planus and she pushes off on the inside here because she has some tightness in her calf, and her foot pronates. And so the more she pushes here, the more callus she develops, which can cause some pain. And the more her toe goes into valgus, therefore developing an exostosis here because the capsule is straining and pulling on the bone, causing some deformation and some subluxation of that joint. So what we want to do is get the toe to go, basically flexion to extension and not ab and adduction to cause that much stress. And so how do we take care of this problem? Well, we set her up with a pair of orthotics that she's had for a while, but she just hasn't been wearing them lately. But since she has started to, she's developing much less pain in the foot. And so we're just offloading the metatarsals and letting those drop a little bit, letting that first metatarsal phalangeal joint drop down also, so she's not having so much pressure. The other thing that's important with an orthotic in this situation is that we want to support the arch so it opens up the metatarsal cuneiform joint, and so that it kind of opens like this, because when it drops into pronation, she now gets more compression there, and because of her tight calf, distributes linear force through the metatarsal into that joint, causing more irritation. Okay, so biomechanically, we're stretching her calf a little bit better. We are taking care of the arch with the orthotic, supporting and dropping off the metatarsals. But here's a nice little trick that I've been doing for years with patients, and they absolutely love this. If you take a look at her shoe, where the laces typically crisscross right here, I've skipped a spot and crisscrossed it above, so now that spur comes right through here, and that gives you a significant amount of relief, doesn't it?
It sure does.
Okay, so even just in the last couple of days, she's been much more comfortable wearing her shoes. She's gotten an increase in shoe size just to accommodate the bunion and bunionette, and that's been much more comfortable for her. So, if we can keep her functional and active, which it seems like we'll be able to do because of these modifications, we really see no reason for her to jump into anything aggressive like surgery at this point, because she's having less pain, she's functional and moving well. And when she starts to see a decrease in her quality of life and decrease in function because of this foot pain, then it's time to seek out some surgical intervention. But in the meantime, she's going to continue wearing her shoes like this. She's going to get a wider and a deeper shoe that she can wear while she's working, and continue to wear the orthotic, and I think she'll be happy. So if you have any questions regarding hallux valgus, callus formation, this big spur at the metatarsal cuneiform joint, please get in touch with me or leave comments, and I'd be more than happy to talk to you about it. Thanks.